Good afternoon, everybody. I am Dr Ansuman Empowers. I am a practicing consultant pulmonologist, practicing in the city of Kolkata. I work with the AMRI Manipal group of hospitals and also the Breathe Chest Clinic. The topic of today's discussion is ILD, which is a short form for the more commonly what we know as interstitial lung diseases. Now, interstitial lung diseases are an emerging class of diseases, as I would say. Emerging because many patients really do not know the term of interstitial lung diseases, and the idea and the concept of interstitial lung diseases is also very poor in our community. Most people would have heard of COPD, many would have heard of asthma, many would have heard of pulmonary tuberculosis, or various other afflictions of the lung, which are more common diagnosis in our day-to-day lives. Our interstitial lung disease is a rather quote-unquote uncommon diagnosis for the common man. Now, this is a group of diseases which is classified by a relentless scarring of the lung, which is usually progressive and causes increasing morbidity and increasing mortality to patients who are afflicted with these diseases. Now, this scarring of the lung is a consequence of inflammation. This is not an inflammation which is caused by an infection, but an inflammation of the lung, whereby the immune system of the lung probably recognizes the lung tissue as something which needs to be repaired as a response to toxins or triggers. And as a result, the lung tissue undergoes constant mechanism of inflammation, healing, and the consequence of healing being fibrosis. Now, what this fibrosis causes is the main function of the lung is exchange of gas or oxygen. It provides us oxygen for various body functions. Now, with increasing fibrosis, what happens is the lung's ability to exchange oxygen progressively goes down. So the principal symptom of this disease is shortness of breath, which is a consequence of the lung's inability to exchange oxygen. And also, an invariable symptom is cough. So most patients will be complaining of cough, which will not be attended by any sputum production, and a progressive but slow increase in the shortness of breath, which will limit his day-to-day activities. Most people would ignore these symptoms in the early stages, and as a consequence, most ILDs in our practice would come in the later stages of the disease when the affliction of the lung is more florid and possibly no correction to the progression of fibrosis that the patient faces. Now, the other symptoms of interstitial lung disease would be progressive wasting, and as a consequence of the patient's inability to perform his day-to-day life functions, the patient will get progressively restricted in his day-to-day activities, and cough can also cause significant social embarrassment to patients. The known causes of ILD are sometimes environmental causes. Sometimes it may be due to smoking-related diseases, sometimes it may be due to reflux diseases, and sometimes we cannot identify any specific cause for this group of diseases, which we call interstitial lung diseases. The principal mode of diagnosis for these diseases would be radiology and lung function, and also, of course, clinical examination of the patient. So the first clues to the diagnosis of ILD would come from a very detailed history and a clinical examination of the patient, where there are typical sounds which sometimes sounds like the opening of Velcro fasteners. So these the sounds which are akin to Velcro fasteners point to a very typical form of ILD. But variations of the same sound may be found in various types of ILDs. Now, in our country, one of the known causes of these ILDs is also hypersensitivity pneumonitis. And in our country, especially in the northern parts of the country, there is a usual custom of feeding pigeons. And people who feed pigeons and are staying within the fluttering of the pigeon's feathers can be exposed to a fine dust which comes from the pigeon feathers, and they land up with a disease called hypersensitivity pneumonitis. Hypersensitivity pneumonitis can also occur with other triggers, other environmental triggers, one of them being various fungi that are found there in our environment, and this also triggers a similar damage to the lung as in a pigeon-induced hypersensitivity pneumonitis. Now, early detection of hypersensitivity pneumonitis can lead to normal lung function, but a delayed recognition of hypersensitivity pneumonitis, which is a type of ILD, can cause permanent scarring of the lungs, which is akin to other forms of ILD. There are typical findings on the CT scan. There are typical findings on the patient's pulmonary function tests, which lead us to the diagnosis. A question which is very commonly asked by patients is, Doctor, what will happen to me with this disease? So the main principle is you have to live with the disease. And how well you can live with the disease depends upon how you are following up, whether you are properly vaccinated for the other infections which can cause a decline in this disease status, and whether you are optimally managed with exercise, physiotherapy and medicines. Some of the medicines can slow down the progression of ILD and improve the prognosis. And the prognosis of ILD has definitely changed over the years. What it was like 20 years back was quite a gloomy prognosis, is not currently so. And many people live many years with some forms of ILD. There are some forms of ILD which can be arrested in their progression, and in fact they are the ones whom we target for early detection. There is no reason to lose hope with the diagnosis of ILD. The main principle is how we live with the ILD is going to define how well we are going to be. Thank you, and hope you all have a very healthy life ahead, free of toxins. Please don't smoke and refrain from exposing yourself to toxins in your environment. Thank you.